Hey everybody, Dr. Jared Skowron from Spectrum Awakening. Today, we're going to be talking about mitochondria, all right? We're talking about the symptoms of mitochondrial dysfunction that are present in autism. So what I want to do first is kind of talk about what mitochondria are, what they do, then the symptoms when they're not working correctly and why they're not working correctly. So mitochondria are the parts of every cell, or most cells. They're not in fat cells, but they're in most every other cell, including the brain, and they create energy. Okay, that is their job. You probably remember from high school that mitochondria are the powerhouse of the cell. All right, I wish I was filming in horizontal so I could really make my air quotes bigger, but they're called the powerhouse of the cell because that's what they do. They produce energy. Okay, mitochondria are very susceptible to damage from toxicity, environmental toxicity, pesticides, plastics, heavy metals. If there's a toxin out there, the mitochondria are usually sensitive to that type of damage from those types of objects, okay, those type of chemicals. So when the mitochondria are affected by those toxins, they stop producing as much energy as they used to. All right. So just think about, if you can kind of put your brain and mindset there, then we can kind of walk through and you can kind of figure out the symptoms as they go on. Because if a cell doesn't have enough energy, it can't do its job, period. Okay. That affects the brain. That affects the brain because if the brain cells don't have enough energy, they're not going to be sending signals. If they're not sending signals, you're going to have a myriad of neurological problems. Okay. The other place we see this a lot is the colon. Now, the colon is your large intestine. What does it do? It poops. Okay. How does it poop? It is filled with muscles. Our intestines are filled with muscles in their lining because they've got to squeeze the food. This is my charades. We play charades next time at a conference. This is your peristalsis of the intestines. Okay. So they've got to move the poop. So when you have severe constipation, it can be due to a mitochondrial problem because physically the colon can't squeeze the poop out. Also, we really need a lot of mitochondrial support, not just for the smooth muscles of the intestines, but for our skeletal muscles. So any of you kids with low muscle tone, any kids who have been, called hypotonic or have hypotonia, talk to their occupational therapist. They'll tell you, hey, we've got a lot of central core muscle tone issues, whether they be central and gross motor skills, or whether it be the fine motor skills of, using crayons and pencils and things, or tying your shoe and trying to do those kind of things. So that is definitely some core symptoms that our kids with autism have. Now, I'm going to show you a list of mitochondrial symptoms. What's important to understand is that there is a realm of severity of mitochondrial problems or mitochondrial dysfunction. If you have mild mitochondrial problems, you're going to have a few symptoms. You have huge mitochondrial problems, you're going to have a lot of symptoms. So what I see people do is we'll show a symptom list, as I'm about to do, and people will go down and say, well, we have this and we have this, but we don't have this, this, or this, so it can't be mitochondrial. And that's not how you should look at symptom lists. Okay, symptom lists are all the symptoms that are going to be present in the most severe case. You can have a mild case or a moderate case and only have some symptoms. This is really important to know no matter what you look at. So let me kind of walk you through it. This is actually from the Cleveland Clinic's website. Cleveland Clinic, very respected, medical institution here in the States. Symptoms of mitochondrial diseases can include, and I highlighted some of our common ones, low muscle tone, okay, learning disabilities, delays in development, autism, all right, diarrhea or constipation. I see constipation much more, reflux, seizures, migraines. This is why kids are headbangers. Kids bang their heads because it hurts and it feels good. When we've got a bad migraine, okay, I'm probably going to be punching my head or digging into it because that pain that I control outweighs and kind of quiets the internal pain. That's why they bang their heads. Could also be from ear infections, stuffed up ears that they're trying to move. So seizures, migraines, etc. And another interesting thing is lactic acidosis, a buildup of lactate. Many of you who have done organic acid tests will have lactate measurements in your oat test, and when that's elevated, it is one of many objective test signs that show that you've got mitochondrial issues. Now, I didn't read everything here, but you can take a look as well. Poor immune system, actually I should have highlighted that. Increased risk of infection, including intestinal candida. okay? So this increased risk of infection. Why would somebody have more infections if the mitochondria is not working? Why? Mitochondria produce energy. Energy for the immune system. Energy to produce antibodies. Energy to fight, okay? So I feel a lot of our kids are susceptible to intestinal infections of candida, bacteria, C. diff, parasites, mold, you name it, because the mitochondria aren't producing an immune system that's working well enough. In fact, that's why a lot of people will get side effects to prebiotics. Okay, what do prebiotics do? Prebiotics feed our probiotics, and they also feed our mitochondria, especially with butyrate. So the mitochondria that are working better and fighting more with the prebiotic supplement are going to cause a die-off reaction. That's why you'll have die-off reactions with prebiotics. So, so take a look at this, and basically say, hey, you know what? My kid's got XYZ. Maybe I've got a mitochondrial problem as part of my puzzle, okay? How do we confirm this? Well, there's three different ways, actually. Number one, you can do an OAT test, an organic acid test. An organic acid test does have some markers that identify different types of mitochondrial problems, okay? The other test you can do is a full genetic test, a whole genome test. That will look at your nuclear DNA. That'll also look at your mitochondrial DNA, okay? Jeopardy question, mitochondria have their own unique DNA. Okay? Now, most of our DNA is in our nucleus of our cell, the center of the cell, but the mitochondria have their own separate, different, unique DNA. Some people with severe mitochondrial issues will have genetic problems in the mitochondrial DNA. Some will have genetic problems in the nuclear DNA. Both affect the mitochondria. So a whole genome test will really highlight severe cases of mitochondrial disease. The other thing you can do, and this is a test we have on our website if you haven't gotten it done yet, this is probably the most unique mitochondrial test that's out there on the market. It's called the MitoSwab, okay? What the MitoSwab does, it's a cheek swab, so you get like a Q-tip and swab your child's cheek, send it in, so there's no blood draw. And this will identify the activity of the different parts of the mitochondria, all right? There's 5 major parts, and they're called complex 1, 2, 3, 4, and 5. They just number them, all right? This test looks at complex number 4, IV, and complex number 1. Well, you got the I right there in Roman numerals. These are the 2 parts of the mitochondria that the lab feels are the most susceptible to causing problems. And what they'll do is they'll actually measure a percentage of activity. So, this part, respiratory complex 4, is at 29%, and complex 1 is at 7% effectiveness, with obviously 100% being our goal. So this is what you're going to get back from a mitochondrial test. When you do this test, it'll tell you A, what type of problems you may have, and B, that'll guide us to what treatments are going to work the best for mitochondria, okay? Because the only thing that really helps mitochondria are natural supplements. I mean, even on Cleveland Clinic's website, the first thing it says, how do you treat mitochondrial issues? It's with vitamins, because there isn't much pharmaceutically out there. So we're going to use specific nutrients and vitamins to help the mitochondria work. What are they? Well, we've got 3 on our website. So if you're interested in any of the supplements on our website for mitochondria, go to our website, spectrumawakening.com, click products, and then there's a category that says mitochondria. We got 3 supplements in there, okay? First off, mitochondria produce ATP. Period. That's what they do. ATP is molecular energy, all right? So we have mitochondria ATP. These are tablets of ATP, all right? Your body can't produce it. You can just take it, all right? So these are tablets of ATP. Next, there are some common vitamins that help the mitochondria produce ATP. So you can either take a supplement of ATP, or you can give vitamins that help the mitochondria produce it, okay? One of the major ones is carnitine. Okay, so we have a carnitine supplement called mitocarnitine. It's got acetyl L-carnitine, and this one also includes a little DHA in there, which is omega-3, like EPA, DHA. So it's got a little DHA along with acetyl-carnitine. The third thing we have is a combo product, and that combo product we have is called Spectrum Needs. Now, this is not our supplement. This is another company's supplement, but we love it so much we do distribute it. This is a more complex formula. It's got over 30 different ingredients, carnitine being one of them, CoQ10 being another, and a multitude of other nutrients that help the mitochondria do their work. Now, the one thing that is in this are wonderful B vitamins. Some kids do really well with B vitamins. Some kids get some behavior problems and some sleep problems when they take methylated B vitamins. So Spectrum Needs is not for everybody. If you can handle B vitamins and you need mitochondrial support, it's great. If you cannot handle B vitamins, what I would do is get things separate, like get the carnitine separate and the ATP separate. Now, the Spectrum Needs does not contain ATP in and of itself, so I will often suggest these two together if you can handle the B vitamins. So that's kind of like our comprehensive treatments behind it. Let's talk about some research that review mitochondria in autism, and then we can we'll answer all of our live questions. So first off, cheaters on. I might as well just wear these from the beginning nowadays. We've got a research study here from 2 years ago, integrating autism and mitochondria. This research study identified that decreased vitamin A will contribute to mitochondrial problems, along with decreased monoamine oxidase enzyme activity, okay? Monoamine oxidase is a gene SNP called MAOA. And we see MAOA problems all the time when we do our SNP genetic analysis. And that is a big cause of anger, a big cause of aggression, a big cause of hyperactivity, and a big cause of sleep problems, and also a cause of mitochondrial problems, along with the vitamin A deficiency. Was pretty interesting. I see a lot of great questions. I can't wait to get to the live Q&A. One of the questions that does come up often is, do you need the test to try the supplements? No, not at all. You can always try the supplements and see if it helps. That's why we've got a 30-day return policy, okay? We have a 30-day return policy because I want you to try things for your kids. I want it to work and I want it to help. But I know everything isn't for everybody, okay? That's just the way of the world. So you try it and it doesn't work, send it back in 30 days for a refund, okay? We've got to try everything to find out what works for your child. Okay, next research study. Autism enrolls regulating mitochondria. Again, this research study highlighted the decrease of monoamine oxidase, the MAOA, also affects dopamine signaling, which affects anxiety and focus, also affects oxytocin and taurine levels, and they suggest treatments with butyrate and melatonin. So, I don't use melatonin often because a lot of our kids get a 4-hour wake up after it. That's why we use our super serotonin supplement. So our super serotonin supplement has a few ingredients in there, but the active ingredient is 5-HTP. It's a nice chewable 5-HTP tablet that converts into serotonin and converts into melatonin, so it's going to be helping that way. Here's another treatment, and it also mentioned butyrate. You can take butyrate as a supplement. It tastes disgusting. Okay, one of my patients, I'll never forget, called it the stank. Okay, so we don't. It's gross. Trust me. So you can give a prebiotic, and a prebiotic will have your probiotics produce butyrate inside the intestines. The butyrate feeds the mitochondria, which kicks out the infections. Okay. Next, autism, mitochondria, and polybrominated diphenyl ether exposure. So this is an analysis of toxicity causing mitochondrial problems. We propose that this environmental toxin, along with other environmental exposures during child development, can induce mitochondrial dysfunction and increase a child's susceptibility of autism. So again, the world's a toxic place, because these organizations are not regulated in what toxins they can put in our world. So they affect us. They affect our kids. They contribute to these problems, okay? Next, molecular characteristics of mitochondrial dysfunction in autism, and this is one of the research studies written by some of the leaders in our field, Dr. Rosignol, Dr. Fry, wonderful docs. I love having them as colleagues. They review the clinical aspects of mitochondrial function in autism include unusual neurodevelopmental regression, gastrointestinal symptoms, seizures, motor delays, fatigue, and lethargy. These are the symptoms of mitochondrial dysfunction in kids with autism. However, let me add a caveat. Fatigue and lethargy are only in the severe cases. So many of our kids are bouncing off the walls, okay? If you got a hyper kid, it does not mean they don't have a mitochondrial problem. Please, all right? Don't look at all the symptoms and say, well, we don't have all of them, so we couldn't have that problem, okay? Some problems in mild, more problems in severe. Next. This is a cool one. GABA goes into hyperactive mitochondria, causing social behavior deficits. Social impairment, kids who have social anxiety, they don't want to play with other kids. They don't want to talk to their peers. Of course, hey, during quarantine, who gets to? Is frequently associated with mitochondrial dysfunction. Why? Because increased mitochondrial activity causes GABA to go into the mitochondria, reducing GABA in the rest of the body. GABA is a protein that reduces anxiety, okay? Any of the big anti-anxiety meds work with GABA, like Ativan and Xanax, okay? They work with GABA, all right? GABA reduces anxiety. So if the GABA is taken out of the bloodstream, put into the mitochondria, it's not there for our brain to use. So mitochondria can cause anxiety this way. That's why we've got nice solid doses of GABA in some of our supplements, Power and Focus being one of them. You got 750 milligrams of GABA. Our Common Cool is a little bit, it's got like 100 milligrams, not too much. But that's how mitochondrial problems can cause anxiety, by removing an anti-anxiety protein. Next, mitochondrial dysfunction in autism. Again, Dr. Roscoe and Dr. Fry, some of my wonderful colleagues, shows that mitochondrial problems cause developmental regression, seizures, motor delay, GI problems, more prevalent in females, elevated lactate. We saw that before. You'll see that on your OAT test. And activated pyruvate. They suggest the treatments carnitine, CoQ10, and B vitamins as kind of your typical general treatments for mitochondrial issues. Okay. And we get in some more research studies, specifically CoQ10 supplementation in children with autism. Doses of 30 and 60 milligrams a day, which in my opinion are low doses. Like the Spectrum Needs supplement has 125 milligrams minimum, okay? If you do this twice a day as recommended, you're probably gonna get 250 milligrams of CoQ10 or more. So it's a nice solid dose, but even on this low dose, they saw improvements in GI problems and improvements in sleep disorders, okay? Pretty cool stuff. Next, two more. This is carnitine treatment in patients with autism, had beneficial effects on intellectual disabilities and muscle strength. They were using 200 kilograms a day or 50 to 100 milligrams per kilogram a day. Too much gave a strong, heavy skin odor. There's some sulfur molecule in carnitine that can come out through the skin, and you kind of smell like rotten eggs. Okay? Hey, if you want to avoid people, why not smell like rotten eggs? All right. Last research study, then we'll get to all the great live questions. First case report of a primary carnitine deficiency manifested as intellectual disability of autism. This was a case study, but they saw frequent episodes of hypoglycemia, muscle weakness, decreased muscle mass, had symptoms similar to high-functioning autism, completely resolved on a dose of 100 milligrams per kilogram a day of carnitine. Okay, so for instance, if you have a child who's 50 pounds, okay, 50-pound kid is about 20 kilograms, so they're doing 100 milligrams per kilogram. That's going to be like 2,000 milligrams of carnitine a day. Our carnitine supplement is 700 milligrams per capsule. So you take 3 of these a day, and you got your 2,000 milligrams. So pretty cool stuff. And the carnitine in the Spectrum Needs is, now I got to find it, 250 milligrams per dose. So if you did 2 doses, you get 500 milligrams. Again, you want to make sure that you're trying different things. Maybe you've done some carnitine tests. We can do carnitine tests through the blood and the urine, figure out levels of carnitine, figure out the right treatment dose for you guys. So let me kind of step back before I answer my live Q&A. Mitochondria are a problem for many, many, many kids with autism. Why? Because of toxicity. What symptoms does it produce? Let's read the list again. You don't have to have all these symptoms. You can have some of these symptoms, okay? Low muscle tone, learning disability, delays development, autism, diarrhea, constipation, reflux, increased GI infections, seizures, migraines, head banging, lactic acidosis, etc. You don't have to have all the symptoms. Mild conditions will have few symptoms. Severe conditions will have more symptoms. How do I confirm? Do the mitoswap test. Do an OAT test, okay? Again, we've got this mitoswap test on our website. You get it on our website. We send you the results, and I write a written interpretation to tell you what does this mean and what you should do about it, because we'll use different treatments depending. So, but again, you don't have to do the lab work. You can try the supplements. Again, I tell most people, if you can handle B vitamins, try the Spectrum Needs and try the ATP. If you cannot handle B vitamins, you get behavior, you get hyper, try carnitine and the ATP, add on a CoQ10, should cover your bases. There's a lot of different mitochondrial supplements out there, but trust me, finding actual ATP is rare. There are many supplements that have the word ATP in them, in the name of the product, but they don't actually contain ATP. So you gotta look on the ingredient list to make sure you get what you want.